Still struggling with dizziness, a racing heart rate, headaches that won't go away, brain fog that makes you feel like you're losing your mind? You've been told that your tests are normal. You've been told that it's just anxiety. You've been told just give it rest, more time. That describes about 80% of the patients who walk through our doors at Tampa Bay Functional Neurology. And almost all of them walk out of here completely transformed in 8 to 14 weeks. I'm Dr. Devin Radford, and I want to tell you why. Here's what most doctors miss. When you go to a neurologist, they're looking for strokes and seizures. When you go to a cardiologist, they're looking for heart disease. When everything on your testing comes back normal, so to speak, they don't know what else to check. They don't know what further tests to run. But your symptoms are real. Your nervous system is malfunctioning. It's just that no one has tested it the right way. Your autonomic nervous system, the part that controls your heart rate, your blood pressure, balance, digestion, all the automatic functions of your body, that system can break down in ways that don't show up on a standard MRI or blood test. That is where functional neurology comes in. Functional neurology is the science of how your brain and nervous system actually work, not just what they look like on a scan. We're not looking for tumors or bleeding, but we rule those things out. We're testing the function of every neural pathway that matters. How do your eyes track? How does your balance respond? How does your autonomic nervous system regulate your heart rate or your dizziness when you stand up? The best part, your brain has neuroplasticity, the ability to rewire itself, to heal. We don't just diagnose what's wrong. We actively retrain your nervous system to work correctly again. Our comprehensive assessment is unlike anything you've experienced before. We literally test your nervous system's endpoints one pathway at a time. We test how your eyes move because specific eye movement patterns tell us exactly which brain regions are struggling. We test your vestibular system, your inner balance, to see why you're dizzy or off balance. We test your autonomic responses, how your heart rate and blood pressure change when you move positions, how they respond to head turns. We mix and match each of these pathways to find exactly what's abnormal. It's like a neurologic detective process, so to speak. And by the end of your assessment, we'll know with confidence whether we can help you. If we can't, we'll tell you honestly. But if we can, you'll finally have a clear path forward. I know what you're going through. If you're dealing with dysautonomia or POTS, your heart racing every time you stand, the exhaustion, the brain fog, you've probably been told it's just anxiety. It's not. And you're not crazy. If you've had a concussion that won't heal, the headaches, the dizziness, the feeling that you'll never be yourself again, you've probably been told to just wait it out. But nothing's been waiting, or you've been waiting, nothing has changed. If you've developed strange symptoms after COVID and no one can explain why, you're not imagining it. These conditions are isolating, debilitating. People don't understand because you don't look sick. I understand. And more importantly, I can help. Here's what I want you to do. Call us for a free 15-minute phone consultation. Tell us your story. We'll listen, really listen. And we will tell you, honestly, whether we can help. No pressure, no obligation, just answers. You waited long enough. You've seen enough doctors who couldn't help. You deserve a clinic that specializes in exactly what you are going through. Call us today. Let's find out if we can get you your life back.